Morning.
We are bringing up a subject that's hard to talk about, yet so many people face. Millions of women and men eating disorders. But you can change and you can get better. On this National Eating Disorder Awareness Week, we are joined by Dr. Theresa Larson, who has dealt with an eating disorder while in the Marine Corps. And we thank you so much for being here.
Thank you, Linda. I'm
Once
excited
again.
to be here.
This is a tough topic to talk about, and especially to say that you've had a struggle with it. And so many people do. So what was your story?
So millions of Americans struggle with eating disorders, and this is something I did not know. I struggled with bulimia while I was in the Marine Corps, and it was a while to recover from it. It built up over time in my youth. It started, like the disordered eating pattern started in college, and just got worse when the pressure started to build as my life started to get busier,
Speaking
crazier.
of pressure, you know, 'cause
Right.
you were in Iraq leading a platoon, is that
Yes.
right? And then also dealing with that. So that's double the stress.
Yes, and so the stress behind it, that's kind of the way that's when it starts, is the people not being able to cope with the stress they have in their life. The depression, the anxiety, maybe they experienced a trauma in their life at some point, loss of a parent, loss of a child. Everybody experiences trauma in a different way, but an eating disorder is an addiction, right? So it's just like alcoholism, just like drug addiction. It just happens to be one of those addictions that you don't get in trouble for. It's like you don't come into work drunk, right, from eating. You might have a little bit of a sugar hangover, or you might feel malnourished, but nobody really picks up on it unless you are, have lost a bunch of weight and or have gained a bunch of weight. But most times you really can't tell with somebody.
Right. I've had so many people throughout high school and college who have dealt with this or touched on it, and just had those kind of tendencies. So it's really more prevalent than people think, isn't it?
A lot more prevalent than people think. And oftentimes in college is when these patterns start, or when children see their parents dieting or are kind of perfectionists in nature, right? They grow up being achievers, driven. Eating disorders don't really look, so the stereotype is a skinny, white, rich female. That's not true. It can happen with anybody, men and women. Actually, 10 million men struggle with an eating disorder, 20 million women.
That's a lot of men and women.
Yes.
What would you say to someone who's out there who is struggling with this and is ashamed or feels bad?
So the thing I'd like to tell the people listening, and this is very important, is that you are responsible for your health. If you know you are struggling, there is shame behind the struggle, because having an eating disorder isn't sexy. I'm the first one to admit that. But I'm also the first one to say that asking for help was the best thing I could have done for myself. I would not be where I am today, writing a book, leading the charge as a doctor of physical therapy, revolutionizing how to take care of yourself, if I hadn't asked for help. I might be dead right now if I didn't. And so people need to take responsibility and just know that on the other side of shame, which is the seeking approval from others, not being happy with yourself, is growth. Growth. There's so much possibility. And then the other thing behind that is, fear of judgment, right? I get judged every day, right, with what I do. It's the way people are, right? People, especially people that are insecure, like to judge. But you have to know that that comes from a place, like you have to look at yourself, if you are a judger, and say, what is insecure about myself that I feel like I have to judge others? But on the other side of fear is courage. So when you do speak up, you do ask for help, you start to care for yourself and show up for yourself, you become a warrior and you heal.
Okay, speaking of warrior, okay,
Yes.
you have a book coming out. I hope you come back and talk to us about that when it comes out.
Linda,
it's your story.
Yes, April 5th is the day it comes out. I'm really excited about it. You guys can find it on warriorthebook.com. You can read 2 free chapters, which is awesome.
Well, come back and see us then.
Thank you.
Okay, Dr. Theresa Larson, thanks so much for coming in.
You're welcome. Thank you very much, Linda.
Hope it helps some people out there.
Yes.